Hello, everyone. Good morning. Very good morning to all. My name is Belinda. I'm from the Rotary Club of Kuching Unity City. So today we would like to share with you a little bit about Rotary Club. So Rotary is an organization of business and professional leaders united worldwide who provide humanitarian services, encourage high ethical standards in all vocational, and also help build goodwill and peace in the world. So Rotary is the world's first service club. So our mission is actually to we provide service to others and promote integrity and also advance world understanding, goodwill, peace, and fellowship of businesses, professionals, and community leaders. So RCKUC, it is basically where we are from. Constantly looks for needs in Kuching community, and facilitate the resources, fill in the gap. Yeah, hearing, mental health, and also eye care are the example of the focus area that we hope to address today. So enough of my little introduction. So today we are going to talk a little bit about our Rotary Cares for Your Health, and that is the main purpose of today's FB live announcement. How Rotary cares for your health, which is taking place from September 2021 to June 2022. Um, Let me introduce you our beautiful panelists today. Yeah, we have got a few of them. The first one is Miss Esther who is from AIA. She is the district manager of one agency from Kuching.
Everyone. Hi, good morning, everyone. I'm Esther Ho from One Agency. Yeah, like how Belinda introduced me. This is my 12 years in the industry. I just joined Lottery Club Coaching Unity City by mid of this year. So I wish I can help more people together with other Rotarians, especially for those people, women. Yeah, women, it's always a group of people that I would like to care more about it.
Thank you, Esther. Yep. Basically, Esther, we have a couple of questions for you. Um,
Mm.
would you be able to share with us what is the contribution from your organization, uh, probably in this area?
All right. I'm here to share not from my industry, but from our club. Yes, Rotary Club. Yes. What is the contributions of our club to the community? Actually, at the club level, we are more focusing. Give me a second. Okay. At the club level, we want to inspire young people to accept and join our Rotary family, and also we adopt a lateral thinking and be creative in bringing significant impact to a local community. And we also provide a valuable and sustainable networking platform for young people to connect, to learn, and to grow as future leaders. Everybody knows that Lottery Club is very focusing on 100%, I would say it's on charity basis. So for our club level, actually we do quite a lot of projects that focus on the people within Sarawak. Yes. So recently we have some projects actually ongoing, including today's Rotary Cares for Your Health. Yeah. On top of that, we also have like laptop refurbishing and donation. And also we have food acts. During pandemic, a lot of people they are suffering. They don't have food on the table. So we do a lot of food acts delivery to the B40 groups. And also we also do some books donation. And recently we actually add on one major project, which is empowering girls and also young women. We just did our first sanitary pad delivery to 2 orphanages. And tomorrow, we are going to deliver sanitary pads again to another 2 orphanages. Then after orphanages, we are going to deliver to the true school and also some kampong lah, to educate the young girls the importance of the hygiene. Yeah, this is what we do at the club level. Yeah.
Okay, Thanks, Esther, for sharing with us on that wonderful information. But probably you could share with us also from your own perspective how this would help the community.
Okay, yeah, very good question. Thank you, Belinda. And we know every little single things that we do, actually we create good impacts to the people around us, either a very big population or very small populations. Our club, we prefer to do a lot of projects and in a smaller scale, then we can keep the ball rolling. We believe in a snowball effect. And back to the lottery, actually we have 7 areas of the focus. Yeah, 7 areas of the focus. Well, the word is so small. Yeah, we are focusing on the hygiene. Hygiene is one of the area that we want to focus on. And we will also focus on the education part, and also the peace. Yeah, the peace, create the peace among our society. And we also focus on the natural environments. How can we make the natural environments better? We also focus on the entrepreneurship and also help people to start up their business with some basic help. And these are the few areas that we are focusing on. Basically, the group of people that we want to target mostly are the B40 group. Yeah, they are very with a very low income and less educated, and they don't have a network or opportunity to develop their themselves. Yeah, these are the areas that we focus on.
Oh, that's really wonderful. Actually, it would really help a lot of people during this current situation. So
Yes.
basically, I'm sure that many of us also would like to understand your long term and your short term goal in this projects that you have been doing, especially empowering women, and during our Rotary Cares project.
Yeah.
What is
Before
what are
I
your short? Yeah, sorry. Go ahead.
Yes. Yeah, thank you, Belinda. Before I joined Lottery Club, one of the areas that I always want to do, I always talk to President Chiu about the single mother, divorcee, and also the women from B40 groups. That is actually my target when I retire. I want to do this part of charity. But Rotary Club actually give me the opportunity come earlier. When Chiu approached me, then he told me that hygiene empowering girls are also one of the very important area that Rotary Club want to do. So that's why I'm thinking of if I can join Rotary Club to start earlier, then at least I can know things, how it works, who are the people that we can give benefits of it. So I started my retirement project much earlier than I expected. So if you talk about the short-term goal, actually I heard one of the story recently. I feel very touching about the story. There's a young boy. Actually, he said at the beach side. He actually picking out those starfish one by one. He actually pick and put them back to the sea. Yeah, and he is very hardworking and he looked nervous. There's a man actually approaching him to ask, "Hey, little boy, what are you doing here?" And the little boy replied saying that I want to pick out the starfish and put back to the sea before the sunset. Then I'll be able to serve them. And the man actually laughed at him saying that there are so many starfish on the beach. How can you help everyone? And what you're doing right now is like meaningless because there are so many on the beach. And the boy actually replied, everyone, he picked out one and put back into the sea. He said, I saved this one. I make a difference to this starfish. So what am I believing in doing charity, helping the society? It's we might not be able to help everyone, but everyone can help someone. If there's a life touched and helped by us, that is the life that we actually make a difference. So I'm doing this on a daily basis. Regardless either related to Rotary Club or not, I actually also do some of my own charity works. Just now I just did one donation as well. So the long-term goal, it's of course I wish to see divorcee, single mother or women who are in a lot of depression and stressful environment, they can actually grow and also get older in a very healthy environment, like what the title of the project say lah, empowering girls and young women, and all these need education and also help, and it has to be sustainable, because this empowering girls and young women, we are planning it to do on a small scale but ongoing, and at least we want to do 3 years to see there will be some changes from the B40 group. On top of the sanitary pad delivery, we also, like in conjunction with our health team, to take a look into the mental health, because as I know, mental health, mostly the patient are the ladies. We are more emotional and we drive by the hormones. So these are the areas that we are going to look into and collaborate with our health team as well. And another upcoming project will be for fresh graduates. We want to help them to look for the ideal job they are looking for, and the employee parts. Also the part we are look into it. There are more and more projects will be ongoing, as long as it can help the young women and the girls. That is the place that I want to see the changes for our society. Hi, Belinda.
Thank you so much.
Am I saying enough?
Thank you. It's a really wonderful sharing. So okay, pretty much that's all from side. So today's session is actually, we would like to promote more on our healthcare awareness, support how we support the well-being and the needy of the needy ones from our Rotary sponsors actually. So let me share with you a little bit more about our intent today. So basically what Rotary offers to you is we sponsor 100 recipients with new spectacles. Eyesight Care sponsors 5 recipients with a digital hearing aid, and a lot more actually. So these will be guided by and shared by our next and other panelists. Okay, so thank you, Esther, for sharing. So we will have upcoming, yeah. So we will have upcoming next some videos.
Are you having difficulties hearing people with a face mask on? Are your parents having difficulty hearing you with a mask on? Hear better today with 20 dB, your hearing professional. We provide and customize to your hearing needs. #1 Malaysia leading hearing center. Meet the new Unitron Discovery
Give this
Next
a couple
series.
of minutes. Let's watch this
Assist
video.
in
This
hearing
is a very
soft
interesting
speech.
one.
Hear speech blocked by a mask on. Stay safe, stay classy, stay with 20 dB Hearing, your hearing professional. Improve your hearing with us today.
Wonderful video. Next, our next panelist, I would like to welcome Miss Yu Xuan. Miss Yu Xuan
Hi,
is
everyone.
from Miss Yu Xuan is an
Hello.
audiologist from 20 dB Hearing Kuching. So Miss Yu Xuan, how are you today?
Yeah, I'm doing good today. Yeah. As Belinda introduced, I am Yu Xuan, audiologist based in 20 dB Hearing Kuching. Many of you might not be aware of the term audiologist or what this audiologist is doing. Actually, audiologists are certified professionals who are specialized in assessing and treating people with hearing loss and balance problem. So in 20 dB, we have more than 40 audiology station in 24 different outlets in all over Malaysia. So what we are doing in 20 dB is we assess hearing for different age population, for newborn babies up to elderly population. We not only assess their hearing, we also prescribe them with hearing aids and cochlear implants according to their hearing condition. Yeah. So basically, this time we are we are delighted to be invited by Rotary Club to be involved.
Yeah, go ahead.
To be involved in this campaign, which is Rotary Cares for Your Health. And then this time we are contributing 5 digital hearing aids for 5 different recipients. And so with this contribution, we actually hope to create awareness on the proper procedure of getting a properly designed hearing aid, because there are so many hearing aids available in the market. The so-called hearing aid might not be a proper one. So with this contribution from 20 dB Hearing, we hope that people would be more aware of the proper procedure of getting a hearing aid. For example, they need to see a professional audiologist to get their hearing test, and also they need to gather all the relevant information before they make any hearing aid purchase. For example, hearing aid styles, hearing aid technology, hearing aid cost, before they can identify the hearing aid that suits them the most. Yep.
Thank you, Ms. Yu Xuan. Okay, there also our questions to you is how how will your team contribute to this current situation, and also what impact do you see that it will bring to the society?
As I mentioned earlier, and as you mentioned earlier, we are contributing 5 digital hearing aids to 5 recipients, and our target recipient in this project or this campaign is those from B40 group, those who have hearing difficulties, but yet they have a hard time, or they have some condition to they hardly afford the cost of hearing aid. So we are targeting this group of people. So at here, I would like to urge those who are watching our live now, if you yourself or your friends or your family members that you suspect have a hearing difficulty, and you think that they need hearing aid, but yet it's hard for you to afford the cost of the hearing aid, I would urge you to apply through Rotary Club to receive the contribution from 20 dB.
Thank you very much. All right then, Xuan, for your explanation and sharing. We will have the next panelist to come on board to share on basically their contribution from their side.
Sure. Thank you, Belinda.
Thank you. Okay, thank you guys, ladies. So the next participant, our panelist, will be Ms. Regal, Lim Re Gal. She is also from 20 dB Therapy 3. Can we invite her on board, please?
Hello. Hi, good morning.
Hi, good morning.
Everyone.
How are you doing?
Good morning, Belinda. I'm doing fine. How are you?
I'm fine, thank you. It's really good to have you on board.
Yeah.
Yes, practically today's conversation is on pretty much on how we contribute to the society in terms of healthcare. Probably you could share with us a little bit about the questions that I have on how your team can contribute, and the impact that you think that it will bring to the society.
Yeah, thank you for the questions, Belinda. I think it's so important. And I think this initiative comes at the most opportune time, because as we know, October is Mental Health Month. And 10th of October, besides the big sale going on Shopee, but it is also World Mental Health Day. So this happens just at the right time. And I'm very happy that I'm representing 20dB Therapy 3 to announce to the public that we are contributing 100 free counseling sessions to the community. So these sessions can be online. We can use Zoom, Teams and all that, or we can use the facilities at 20dB Therapy 3, to have physical sessions to talk face to face. And all these sessions will be provided not by lay counselors, but by trained postgraduate students enrolled in UNIMAS at the local university. And we have quite a few volunteers on the team right now, coming from different backgrounds, different gender, different age, different life experiences. So I'm very sure that all these volunteers can contribute and help people who reach out to us. No matter your age, no matter your issues, we have people who can understand on the team. Belinda, could you unmute?
Sorry, I was saying.
Hi again.
What is the what is the long-term and short-term goal of your team in order to support this awareness, this campaign, and also the well-being of our needy what do you call that? Our citizens. Yeah.
Yes. Thank you so much. The short-term goal, obviously, we are going to have this community service hopefully conducted from now until the mid of next year. We are well aware of the impacts and the mental health challenges brought upon by COVID-19 pandemic. And we have so many data and statistics available to us, and news after news that appear on the newspaper, that actually 1 in 4 people, even before the pandemic, 1 in 4 people will have some kind of mental health struggles. And in this pandemic, we have seen read reports that 40% of adults, in this year, on the 1st of January 2021, 41% of adults actually have mental health issues in the US. And in Malaysia, in our local context, from last year, the first day of MCO is 18th of March, right? So 18th of March to the end of the year, we have averaged 1 suicide case every day. And then this year until until the first 3 months of the year, only the first 3 months, shorter period, but we have on average 4 suicidal cases every day. So we can see that the impacts are really there, and it's affected people emotionally, mentally, psychologically, and yes, also affects on their, let's say, family, their marriages. And we see reports of domestic violence, child abuse, child neglect, a lot of work issues, a lot of burned out, stress, all this, we see so many reports of that. So our long-term goal would be to help, to offer maybe some solace, some psychological, psychosocial support. Perhaps if people would like to seek for new clarity, new direction, or simply listening ears, there are people available, community service available to these people. And on long-term basis, because even after the pandemic is controlled, well under control, and we have entered into the endemic phase, there will still be long-term mental health challenges. People will still be, recovering from let's say anxiety, depressive symptoms, let's say post-traumatic stress symptoms, let's say some behavior changes, like people will be very fearful of going participating in big groups, or they will be keep washing their hands to make sure that it's clean and not to infect. There will be so many challenges and adjustments going on even after the pandemic. So this service, the counseling service, will be there to help people recover from the aftermath also. So, and I would just like to say this again, that this service, is provided by trained people, trained people, enrolled in a master degree. It is so rest assured that these people, they are trained and skilled, and also rest assured that all the sessions are confidential and they are free. So I believe all of you can see the QR code at the background. Feel free to scan the QR code, register for free counseling sessions. This is especially useful, I believe, for those who are struggling financially, who cannot afford counseling sessions, because counseling sessions are not cheap. And also it doesn't end with one session. It may go on for a few sessions, for a few months, or maybe years. So I really encourage everyone to grasp the opportunity. If you know anyone who needs this service, feel free to reach out to us, calling the Rotarians. Okay. Yes, over to you, Belinda. I think I talked too much.
No. It's really, really nice sharing. It is a wonderful sharing, Regal. I really appreciate that.
Thank you.
Doing resolving the trying to resolve the health awareness situation. Yeah. Yes. So okay. Thank you, Regal.
Thank you.
Let's see if there's any questions and answer from the comments. Okay, I think we should proceed to the next one. Yeah, I would like to invite our next panelist. So our next panelist is Ms. Jun Ong. She's the optician and director of Guan Leong Group, Sdn Bhd. So a very, very wonderful lady to share with us her insights. So before that, maybe we will watch the video that has been prepared. Thank you for the video. That's really wonderful video. We would like to our next panelist is a wonderful lady, Miss Jun Ong. She is the optician and director of Guan Leong Group, Sdn Bhd. So let's welcome her, and then of course, Jun, we are excited to hear your insights of the contribution towards the health awareness campaign from Rotary. Over to you, Jun.
Hello, Linda, for the introduction. Okay. First of all, I'd like to thank Rotary Club of Kuching Unity City for having us to take part in this project, because by having an experience in this optical in more than 20 years, because we really strongly believe that the eyes are very important, especially in our daily activities. I mean, except we sleep, I mean, once we open our eyes, we start to use our eyes until we sleep again. Okay. Now, since just now to Regal, and also we have a talk with Regal and Yu Xuan that October is actually a lot of things happening. It's actually the health month, the mental month, and also October we have the there as well in October. So good, a great time to start with this project, because we have actually do all this previously. We've always do this project with all other as well. So in that, because of actually global statistic, there's actually 1 billion people who have actually near and distant vision impairment. And for the WHO, actually, they are targeting to increase the effective coverage for refractive error by 40% by the year 2030. So I think it's a opportunity that we hope that our company can contribute a little bit to this figure so that everybody can have a better health. So we are actually giving out 100 pairs of spectacles for the ones that who actually need. The purpose of we doing is actually to encourage people to go and have their eye check, because according to our experience throughout the years, actually a lot of people that do not know they actually have vision problems. Because when we start going to all these kampongs or everything, lots of people just don't know that they can actually see better. When we just do the refreshing and put on the trial frames or trial lens, they can, wow, I can see really clear. And especially we call it the kampong, the old makcik and pakcik always tell us that, oh, maybe it's just what do you call it? I'm old. Much they said memang is a very, it's normal that our eyes is, they actually don't know that we're just by putting on a pair of glasses, then they can see, they can do all their works normally. Yeah, that's why I think that is actually very important to get your eye checked. Eye check, it does not have for anything, and I believe most optical shop don't charge for that. Just please don't be afraid to go check. That's my main purpose for doing this.
Yeah, I always get my eyes checked. Every time they keep telling me, "Oh, your eyes. I think your degree has increased because of due to the long hours of screen time." So yeah, I guess you basically what you mentioned is right, Ms. June, that we should always get our eyes checked. But what about how would it help the society in terms of the free eye check projects?
Okay. Because according to my experience and all these almost 20 years in this industry and with doing, people actually don't problem, especially not urban area, the rural area, even the urban area. Let's say if their parents might not have we call it short sight or long sight, that they don't realize that actually sometimes their children is having this problem, the vision problems. Okay, I have a case that a mother keep telling me that when the children is young, and one of these particular this particular kid is actually don't like to go to school, don't like to study, don't like to, they thought that maybe this is they just think that maybe she is a problematic child or anything, but then, or maybe she's getting bullied at school or anything. Then after finding out nothing happened at school, everything seems to be normal. So last resort is to get a consultation from doctors. Only that they find out that she's actually having short-sighted. See, she can't see. That's why she's very very anxiety, doesn't like to go out, doesn't like to read or anything. But then by just putting on a pair of glasses, when she can see clearly, then it's like everything's back to normal, and she actually do quite well in her study. And then it's actually according to the mother, she actually scored the top reading. You imagine just by you can putting a pair of glasses, then she actually changed her life. If like the parents never notice, never know that this happened, then it might affect the child for the rest of her life. We don't know what happened. You can solve this problem easily just by putting on a pair of glasses. So I will advise that if you think any problems or suspect any problem, just bring your kids to check your eyes. Okay, it does no harm. Just tell your kid that it's not painful at all. Okay, all you need to do just read something. Right, that's my message. And also for the old people, actually we start to have say around 40s, then we will have this vision problem, especially near. Sometimes you see people like when if they're wearing glasses, you see people starting to take off their glasses when they read something near. Or the one that not wearing glasses, you will see that sometimes they put their hands so long to read the things, is so make their reading material so far away. So this is the sign that you are having the reading problems. Commonly we know that we call it as a 老花 lah. So please go and do your eye check. So you don't have to suffer but have this eye straining when you have to do all these things. Just by a pair of glasses, you can solve all your problems, and it makes your life easy, right?
Yeah, that is a really wonderful sharing actually, on how you explain, how your team actually assist in benefit the society with this initiative. So just to share with everyone, practically, this is our project partner, Guan Leong Optical. We have a branch in BDC to donate 100 pairs of spectacles, basically frame and multi-code lenses. So I believe these projects, would you be able to share a little bit more?
Okay. We have been actually doing
I believe the
in
target would
conjunction
be
with
like
other
students
NGOs.
and
We
university
always
students,
go
right?
to as for Rotary, the target groups will be the students from primary to university and poor. But for us, if you want to do the eye check, please just come anytime to our outlets. We don't charge you for that. For anybody who you think or you suspect you might have this problem, just come. Yeah, we'll do the eye check for you. Then you decide what is your problem actually. Yeah, then we will just do. But anything, if you really aim for the 100 pairs of, there's actually the QR code and fill in the form, and we all pass through it. Once the Rotary say okay, just do it, then we'll just do the glasses for you and just give it away.
That's a really
Answer your
wonderful
question,
sharing,
Belinda?
Ms. June. Yeah, very, very wonderful sharing and information that you have shared. Is there anything else that you would like to share with our our viewers on the team on today's topic as on mental awareness,
Okay,
mental health awareness?
Okay, one thing that I really want to a message that should consider to all the parents, because we have always heard that my kids may be lying that they cannot see clearly at school or whatever. Sometimes just please trust your children and bring your children to an experienced eye care practitioner to have their eye check, because there's no harm to actually bring them to have a check. And then you should do your eye check every year, especially children. If they have the eye problem, then might have to check every 6 to 12 months. So please do trust and bring them if they do tell you that they can't see clearly. And parents also, maybe sometimes the children that is too small, they can't say it clearly. You just observe if they keep rubbing their eyes, or they keep blinking, or whenever they see the TV or anything, they just walk very near. That might be the sign of that they're actually having the eyesight problem. Just bring them around, because sometimes you can't blame the parents, because sometimes the kids actually see their friends is wearing glasses, they think that is nice, they want to follow too. But then I'll say just bring the kid. If you have no problem, we'll tell you no problems. Yeah, don't worry about the checking actually come.
Yeah, I agree. Yes, that's a very important message to everyone, especially parents with children, or even yourself. If you do have some concern with your eyesight, please do quickly go and do a quick eye check. Then pretty much, I think all from my side today. Ms. Jun, thank you very much for your time, and thank you very much for your sharing.
Thank you very much.
Yeah. Let's see if we have any comments or questions from the viewers. Okay. I don't think we have any questions. Right. Can I invite all the panelists on board, please? Great. It's really wonderful thing from all of you. It has been a wonderful time, and today's session, I think not just myself, I believe our viewers will also have learned a lot from this session, especially from Esther, from Yu Xuan, Ms. June, and also Ms. Re Gal. Yeah. So thank you very much. And shall you have any comments on the club? Club Kuching activities, then please actually record on the banner is for you to reach us. So thank you, ladies, and have a wonderful day ahead.
Thank you, Belinda. Thank you, everyone.
Thank you.
Bye.
Thank you. Bye.
Blessing weekend.
See you soon.